Spleen structure measures around 12 by 7 by 3.5 centimeters, weight approximately 150 grams, with 300 milliliters of blood volume. There's normal structures such as the white pulp, composed of primary, secondary follicles with the mantle zone, periarterial or lymphoid sheaths. The red pulp has sinusoids and cords, and supporting stroma involves the capsule and trabecular septa. This is a gross photo. This one seems to be lacerated, but it's good to have ruler and described any surface abnormalities. This is the hilum, where you have splenic lymph nodes and vasculature. Uncut surface, most times it's beefy red. Here again, without gross white nodules or large nodules, but this is pretty beefy red. So normal histology, again, you have the white pulp composed of lymphoid cells, red pulp, trabeculae, again, some white pulp. You could see extramedullary hematopoiesis with erythroid elements, megakaryocytes. That's often seen. Again, white pulp areas with lymphoid cells. Again, white pulp, red pulp. Again, like the lymph node, germinal centers with mantle zones, little small vessel. Here again, central blast, central sites, mantle zone. And the red pulp, you have sinusoids. These are benign blood vessels. So this is a case of a spleen, but this looks quite different. It has this nodularity, ill-defined. Histology showed back-to-back granulomas, some with centralized necrosis or necrotizing granulomas. This was AFB positive in an HIV patient. Sometimes the spleen can infarct and shrink, such as in sickle cell anemia. They can scar. Other therapy-related changes due to like corticosteroids, rituximab, phenytoin after bone marrow transplantation, diabetes, radiation, thoratrust. You can look up histologic changes. They're pretty non-specific. Other non-hematopoietic lesions include cysts, either epithelioid or infectious, hematomas, inflammatory pseudotumor, hemophagocytic syndrome, and metastases or extrinsic cells. Be aware and know your vascular splenic lesions, including hemangioma, littoral cell angioma, hamartoma, lymphangioma, SANT, called sclerosing angiomatoid nodular transformation. I'll show some cases. Angiosarcoma, inflammatory pseudotumor, and peliosis. So this is an example of SANT. What you see on radiology is well circumscribed nodules in the spleen, and grossly they're quite well circumscribed with a central radial scar. Here's another case here. Here's another here. These were cases described by our fellow Ashana Koreishi. She put together a series of these cases, but so they're well circumscribed and they have this prominent white scar. And histology, I'll show this again, well circumscribed nodule adjacent to normal spleen. They're somewhat suggestive of vascular change of fibrosis. Here again, next to the nodules, you have these sclerosed vessels, better seen on reticulin stain. And by the vascularity, either seen by CD31, 34, or CD8 on the red pulp with these markers, are somewhat reduced in the Sant lesions. Here's another case, a cut surface here, but here's one courtesy of Abir Salama. Again, freshly cut, but you see this white central scarring on more fixed sections. Again, they're somewhat well circumscribed, but it has this radial, like white scar appearance. And histology, again, they're very well circumscribed, somewhat paucicellular, fibrotic, and here's normal adjacent spleen with white pulp preservation and the red pulp. Then again, next to it, you see these vessels that are has this proliferation here. Here again. Here's the white red pulp. Then on CD8, you see reduced vascularity compared to normal red pulp sinusoids. CD34, again, some vessel proliferation compared to normal spleen. So Sant, as I mentioned, stands for sclerosing angiomatoid nodular transformation. It's a rare benign vascular lesion of the spleen, first described by Drs. Martel and Dr. Rosai back in 2004 with about 25 cases. The non-neoplastic nodular vascular proliferation of red pulp shows prominent sclerosis, as I showed you with the characteristic gross histology and immunophenotyping. The nature is uncertain. Some people suggest this might be a sclerosed hamartoma or some sort of stromal response to an organized hematoma. Again, differential diagnoses include hemangioma, hamartoma, hemangioendothelioma, littoral cell angioma, inflammatory myofibroblastic tumor, or desmoplastic response to metastatic carcinoma. So here are my references. Thank you very much for your attention.